Hello, everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and today I'm so thrilled to have Dr. Jennifer Haddad with us. She is from Southern California. She has been practicing for about 11 years after graduating from USC, where she was trained with some of the top leaders in the industry, one very particular name, Dr. Pascal Magne. And the philosophy that she's learned and adopted is less dentistry is the best dentistry. So since then, she's been trying to restore form and function along with aesthetics. So in this episode, we dive into her approach to crafting exceptional smiles. We even touch on the 5-year rule for finding your passion in dentistry and the steps she takes in order to make her life and career more fulfilled. Let's dive into this conversation. Dr. Jennifer Haddad, thank you so much for being on Teeth Matter.
Thank you so much for having me. I've actually been so excited because I've followed your account, and I love that you take the time to record podcasts, within the dental community for dental students, for pre-dents, for dentists. Like it's that's something I actually wanted to do, but I don't have time. So thank you for doing it. And I'm thrilled to be on here.
Oh, it's amazing. And I love that the community is growing. And I think you're going to share some insights today that the audience would truly, truly appreciate. And I want to start by asking you some questions. And one of the questions I want to ask you is, you've mentioned in other conversations that you've had a lot of mentors in your life. And there's a name that really comes out or stands out to me. And that's Dr. Pascal Magne. And I want to know, who is he, first of all, and what that name means to you?
So that question is so loaded. I mean, the fact that you ask me that shows you how important he is to me in my dental practice, my dental career. Dr. Pascal Magne, if you don't know him, you will get to know him in the dental world. He is the father of biomimetics. He's the one who he's the one who came up with biomimetic dentistry. So that is solely the way I practice. I mean, he is such an inspiration in so many different ways, but specifically, the reason why he means so much to me is because I have learned really the core values of how I practice dentistry. And like I said, he is someone that I have always in the back of my head whenever I see a patient, when I'm working on a patient, because the techniques, the procedures, again, the way that biomimetic dentistry works is really to a degree of quality, of excellence to the highest degree. And what I love about Dr. Pascal Magne is that he's basically like the Michael Jordan in dentistry. And what does that mean? He is someone that has worked so hard for so many years. He's done years of research, years of publications, years of teaching, in dental academia. And he really is an expert in his field. He is also someone who holds a very high standard. And what I mean by that is that his passion for what he does, it goes unnoticed. I mean, the way he presents his material, his lectures, the way he invests his time, his heart, he's so passionate about what he does. And that I admire that the most in anyone or anything. I think you have to have that passion in order to succeed, right? That's your motive. That's your driving force. So to have someone like Dr. Pascal Magne in my life, I'm so grateful. He is not only my mentor, he is not only an educator of mine, he is not a colleague of mine, he is also a father of mine, in a sense, father in dentistry. We always talk about that. He has sons and daughters in dentistry. So I'm really fortunate that I am part of that family. And with him there, I am always trying to hold myself to a higher standard. I could tell you that much, So That's who he is to me. And like I said, if it's someone that you haven't heard of, you will learn about him, you will hear about him. I mean, he's created and really brought to the dental community a huge, huge aspect of techniques, procedures, just ways of doing things, to a very high quality.
At what point in your career did you meet him or encounter him and start to like gravitate towards this field of biomimetics?
It all started at USC. I was an undergrad at USC, and that's how I essentially learned about him. He was faculty member at USC, and I'll never forget, he was known for, again, biomimetic dentistry. To be in his clinical section is like such a big deal because he was also very, not in a bad way, but a very good way, harsh in regards to his expectations for his students. So either you shied away from that or you were like, hey, I need to learn from someone like this. I want to be as good as what his expectations are, in dentistry. So I gravitated towards that. And I think it depends on the type of person you are, your goals, your aspirations, I don't know, your likes and dislikes in it as a person and how you do things. And that's how I ended up getting to know him in dental school. And lo and behold, I loved, more of the cosmetic dentistry aspect of what it is that dentistry can provide in regards to all the different specialties. And as I went through dental school, I did whatever I could to try to be involved. But specifically, it wasn't until I graduated that I was then connected to a very unique dental practice in West LA. And the owner doctor of that practice was also faculty at USC, was very involved at USC. And the way that he practiced was all based on Dr. Pascal Magne's biomimetic dentistry philosophy, So then I really got to incorporate myself into that community. And I then became super involved with biomimetic dentistry because once I started working, I then took the time to go back to USC. I was a faculty member with him, one of the TAs helping his morphology class. So I involved myself in that way. So then I became, part of his team in helping students, just learning, again, high quality dentistry. And we're talking about morphology, the basics, right? The first year of dental school. So that's how I ended up getting involved. I practiced, every technique that he basically has introduced to dentistry, CE courses, all of that stuff was very much, that's how I got involved, essentially. And now we're here, and I'm part of Magne Education, which I'm so honored to be a part of. And he, like I said, we have a relationship where he just knows me not only in dentistry, but just as a person, as a family member. And I'm so grateful for that.
It sounds like, you got a great schooling and education at USC because you were introduced to so many people who are leaders in the industry. And you mentioned like him being very disciplined or strict, and you emphasize this word high quality dentistry quite a bit. You've repeated it a few times. So I want to know, what does high quality dentistry mean to you?
So in dentistry, that's a multifaceted question, right? In dentistry, you have patient needs and patient care. So patients' needs, right, are the needs where they are like, hey, I'm coming in, I want to make my smile better. So that's where you look at a patient and you want to do whatever you can to emulate a natural smile or a natural look while also conserving tooth structure. So you're mimicking nature while you're also trying to conserve your tooth structure to the best possible way that you can, and that's going to be through your, procedures and treatments. High quality dentistry is how you then deliver that treatment, how you deliver the final outcome. Again, instead of taking shortcuts, you're doing things where it's very clean, I would say. Then you're talking about, let's say, patient care. Patient care is someone who comes in with disease, and that's something that obviously needs to be addressed, right? So how can you basically remove that disease by also preserving as much tooth structure? That is high quality dentistry. It's very easy to remove teeth. It's very easy to just get rid of teeth and do something that is not preserving the tooth structure, more than trying to just work with what you have and trying to preserve what it is that you have. So high quality dentistry, I don't ever want to say needs more time, but it needs more consideration. It needs more love and affection in a sense, because again, extracting teeth is one thing, but if you could do whatever you can to preserve that tooth, you're increasing the lifespan. Again, high quality dentistry. How do you increase the lifespan of a human being? I don't care if we're talking about your hair, your skin, your nails, your body parts. We're talking about teeth here. But if you're doing high quality healthcare anywhere, you're going to help to preserve whatever it is and keep it for as many years as possible, so that the patient could have a better quality of life with their own health, right? Their own, again, teeth. So that's what that means to me, essentially.
I mentioned you take time. It requires consideration. And we talked about this offline, where there's different types of offices. And I'm sure when there's a new dentist who's coming into their career, they're looking at different offices, and every office functions differently in terms of scheduling, in terms of patient demographic, insurance, not insurance. So when I want to know, when you're giving consideration, right? Like if a patient comes to you and they want to, they're there, they come to you for a consultation. I want to know, when you smile design, let's say, what does that look like? Like, what is the process? How much time are you investing? What are the stages? So that when a new dentist wants to provide that quality of care,
Mm-hmm.
what do they need to do?
So that's a great question. The biggest thing when someone comes in to me for a smile design is that I look at each patient and I'm like, okay, how can I make you a better version of yourself? I have the tools, I have the education, I have the clinical skills. I know how I could make someone look better with their smile. And so the biggest motivation for me is keeping the best interest of the patient versus, oh, how many teeth can I do? That's not the case. You're looking at each case is so unique, it's so different. And I don't know if you've noticed this in your practice, but like there isn't one person or two people that have the same set of teeth, that have the same set of smiles. You're never going to see that ever. And so you can never sit there and create the same smile for two different people. It just doesn't work that way. So each case has to be planned according to each person and each patient, their needs, their wants, their looks, their facial, you have to do it like a facial analysis. But anyways, I'll walk you through it. When someone comes in, they come in for a consultation with me. What does that entail? It entails that with the consultation, they get an hour of time with me, where we take a digital scan, we take photos, we take x-rays, right? The basics. And with that information, I could then review it with the patient, go over, what it is that they need to basically sign up for in order to achieve a certain look or a smile that they want. Now, if they are, after we've discussed the options in that appointment, that will dictate their next appointment. So their next appointment will be an appointment where I have now taken that digital scan. I have created a model or a digital wax up, let's say, of what it is that I am proposing for them. And again, dependent on the case, if a mock-up is needed where the patient can try it in the mouth, that's going to be a separate appointment. and we go from there. Then you have another appointment where, you do it's the procedure day. So whatever treatment needs to be done, that's then set separately. And again, it depends on what it is that you are talking about. There's obviously composite veneers, there's porcelain veneers, there's something as simple as an internal bleach. Like there's so many different procedures and techniques to enhance one's smile. You have ortho. I mean, just so many different options. But again, it all depends on the patients, their wants, their needs, their time, their finances, their outcome. What is it that they want to achieve at the end of the day? So that's kind of the process of what it is that I go through with a smile design.
With all of these considerations, how many patients are you seeing a day?
My schedule is about, I would say, between maybe, it could be as little as one patient a day. It could be, if it's a procedure, or it could be up to like 8, I would say. So between 1 to 8, give or take, throughout the day.
And before you went into dentistry, you had mentioned in another interview that you went to observe another dentist, and there, before going into it, you knew you were going to hate it. You said you knew that it wasn't for you. I wonder what changed.
So funny. It's funny how God works. Like you think you have everything planned out and then you really don't. It just takes like a complete turn. But so I essentially was on the route to becoming a pediatrician. I was all about, going into the medical field. And I had so many of my friends who were in the medical fields. They were in medical school and all that stuff, and they hated their life. And I'm like, you guys, we work so hard, undergrad, all that stuff, testing, all this crap. You invest so much time, right, and effort to get to where it is that you need to get to. And then you end up hating your life. Like, I just did not want that. So what I did is I ended up taking the time. I had a little checklist, right, of all of these healthcare professions that I wanted to just take the list and be like, okay, I've done my duty. Because no book can tell you what it's like. No person can tell you what it's like. Every person has a different opinion, right? So I had to take matters into my own hands. And what I did is I was like, I'm gonna actually put myself in an actual work day of whatever profession, whether it was a chiropractor, whether it was an ophthalmologist, whether it was a physical therapist. Again, dentist was on the list, right? So with dentists, most people are like, ew, like saliva, blood, tongue, gross. Like it's not a glorified profession at all. It's actually like a gross profession, I would say. When you think of it, like now, saying this now as a dentist, because I love it so much, I'm like, people are crazy. But the reality is that before you get to know that you have a love for it or an affinity for it, that's what you essentially think. So I was like, this one's going to be an easy one. I'm going to go in for an hour. I'm going to cross it off my list and move on my merry way, right? So I was a student at USC. I randomly called the faculty practice at USC, like a little, newbie. And I was like, hey, I just wanted to see if I could, shadow a dentist. I'm interested in seeing whether or not this is something I would want to do. So I take the time. I go to shadow a dentist by the name of Dr. Timothy Saunders. They just paired me up with him. He's like someone in my dental career that I forever am grateful for. But I got to spend time with him the first day, and I was like, there's no way I kind of like this. This is weird. I loved his interactions with his patients. That's what I love the most. It was so interpersonal. He gave time to each one, but he was also doing his work. It was such a fun hour of shadowing that I experienced. And then I literally was like, hold on, I need to do this again. There's no way one time is gonna, give me the answer. So I kept going in as much as I could. And I'll never forget, I call my dad like a week later. I'm like, Dad, it's really weird, but I think I'm liking dentistry. And I had to get like his approval in a sense because he's known my heart for medicine. Like I was like so laser focused. Everyone would tell me don't do it. And I was like, no, I'm going to do it. Um, and I'll never forget that phone conversation with my dad. I was like, would you be mad at me if I went into dentistry? Like I'm actually like getting approval from my dad. He's like, honey, I want you to do whatever you are passionate about. And that I'll never forget kind of changed everything for me.
That's really funny. I also was interested in pediatrics. Like I was the kid who loved going to my own pediatrician. I think I had a really great physician
Yes.
growing up, and it made it fun and exciting, and I liked the environment that I was in. And then as I got older, I was more and more exposed to dentistry, and then I had family who was in dental school, and I got to go shadow them in residency and whatnot. And I was like, you know what, I'm going to go be a pediatric dentist. Like that's what I want to do. And it wasn't until I went on this like mission trip to Nicaragua where I was like, oh, I can help people out of pain. I can help mostly like the education component, which is like I can help them avoid pain or helping them understand simple tools and techniques that can, keep them healthier. So that's when I pivoted towards dentistry instead of medicine. But it was cute that you were also thinking about pediatrics.
I can't believe you wanted to go into pediatric dentistry. Once I got into dentistry, I was like, perfect. I'm now going to just go into pediatric dentistry. So that's something that not a lot of people know, other than if you were my classmate in dental school. When they found out I didn't even apply, they're like, what do you mean you didn't apply to pediatric dentistry? You're like, you're all about it. I'm like, I just can't let go of my love for working with adults and like making their teeth pretty. I don't know. That was the struggle for me, So you're constantly trying to find your path in life. It's crazy. Like you think you know. I can't believe you wanted to become a pediatric dentist. And you're telling me you love oral surgery and endo. Like
Well, then I started seeing pediatric patients, and I'm like, they're cute. I love kids.
yeah.
I have a big family with a lot of kids in there, but for some reason I can't treat kids. Like I can't do it.
Yeah, yeah. No, it's so different.
It's very different, and God bless pediatric dentists. But
Really. Really.
uh, well, you mentioned the interaction Dr. Saunders had with patients. Do you value that right now in your own practice?
Care about. I tell people this all the time, and I think this is why I have the practice that I have is because I care so much about people. So obviously the reason why both you and I are in the field that we're in is because we're in a healthcare field, right? So we've always had that affinity to help others. And I think with their health was a huge thing. But I value the one thing I did not like about medicine was the fact that it was such a rushed experience when I would shadow doctors. I didn't like how there wasn't that personal, like that's especially now. If you think about healthcare now, I mean, now talking about back then, I don't know, 15, 20 years ago, like at least there was a little bit more consideration of a patient. It wasn't like, let's do this so quickly, like it is now. It's like that everywhere now. But that's what I'm trying to preserve in a sense is that quality of care, that time, that connection with my patient, that letting them know that I care so much about them, like their teeth are like my teeth in a sense, and I know they care about their teeth. They're there, taking care of it. But I value the fact that they make time to make an appointment because I know how busy life gets. I value that they're coming in and it's not necessarily fun to just have someone in your mouth. You don't know, you can't see anything. You're just trusting someone. I mean, we're patients ourselves. And when I'm a patient, I'm like, wow, okay, my patients must really love being with me because otherwise, like, I wouldn't put up with it necessarily. Like, it's not easy. So That's a great question. I mean, that's what I was looking for. I was looking for a profession that allowed me to really commit time and myself to giving and providing quality care, whatever field that may be.
Right. It's funny, I was getting a cleaning done the other day and I was laying back and I looked at the hygienist. I was like, is this a good time to tell you I have dental anxiety?
It's true.
Because I'm just paranoid that what if, something happens, because you can't see, you're only going by sense of feel, right? So it's just, it's an uncomfortable and very vulnerable position to be in. And I really do
100%.
think like that interaction with patients is what really makes my days, because we laugh, we connect, they trust me, and they come back and we continue to share and make a story, or have this journey. And so for me, that's really important. Now, you mentioned Dr. Saunders, you mentioned Dr. Manet, you, you've had many other mentors in your career. The one you also mentioned someone from your practice in West Hollywood, I believe it was.
No, you're fine.
Had a lot of mentors in your journey as a dentist. What would your life or career have looked like if you didn't have these mentors?
Very different, very not me, very like you, everyone needs a mentor in life. Everyone. I don't care how much you think you know. I don't care where you come from. I don't care. Like, people need people. People need to elevate people. We all need each other. I don't, I cannot wrap my mind around the concept of self. Like, it's all about me. I could do it. It's me. It's me. It's me. That's the world that we live in now. It's all about, I could do it all by myself. I'm independent. I could figure it out all on my. No, you cannot. You cannot be who you are unless you have others supporting you. You support others. You are uplifting others. They are uplifting you. Like, and finding the right people too. I mean, that's also key, because you, just like friends, just like when you're getting to know people and you're trying to figure out who I want to be friends with. Um, it's the same thing in a work environment, whether you're a student or not a student. I mean, you're learning, you're constantly learning. And in dentistry, it's called the practice of dentistry for a reason. You are learning as you are practicing. And without mentors, you could basically go down the wrong path in your life. Because if you think about it, like, okay, I've been practicing for 11 years. I have some insight for you. I remember when I was at your stage, 2 years out, like, I could give you some feedback, like I could give you some tips, and so on and so forth. You're 2 years out. Guess what? You can tell someone who's going to go into the work field, like, hey, this is what you should consider. This is what you should look for. This is what you might experience. Like, this is the real world, and I think it's important. And not only with advice, on how to manage on a day to day, but like even with techniques, with procedures, treatment planning. There's so much to learn, and to learn from others, and to learn with others. Like, absolutely, when you are going out there, please find yourself a mentor. I don't care if it's a family member. I don't care if it's a faculty member, but there has to be someone that you can rely on. And that's something I also provide, through Instagram, which is really cool, like a social media platform. I've had people message me who know, like, their family friends or something like that, that want to go into dentistry, and I've gained so much from my mentors. I literally, it's my way to give back, to others. Um, because I got so much out of it, and I still do get a lot out of it too, you know.
I want to piggyback off this because offline, you and I were chatting about this being growing pains. Like you mentioned, like the 5 year rule, like 5 years of growing pains. Can you just elaborate on that? Because you've had mentors and you've had people around you, and yet you said that you were struggling finding yourself and you had trouble in different offices, or finding your path or your passion. So I just want you to just maybe share a little bit more.
I like that question. So the 5-year rule, I'll never forget, you know, getting out of dental school, and I'm like, okay, listen, I actually, my mindset was never like, I know everything. I to this day still have that mindset. How can I get better? I'm never like, oh, I'm the best. Oh, I know everything. No, 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 no. Because you're constantly growing. You're constantly becoming, you should be becoming better. You should be growing yourself at all times. That is something that I just never stopped doing, you know? So when I started dental practice, I was very fortunate to be practicing in a very high quality dental practice. But I also, because it was part time, made sure that I also had to fill my schedule for the remainder of the days. And it was, of course, as much as I wanted to be in just a high quality practice, I had to figure out how I could, again, fill my days. And that's something that I ended up interacting with certain faculty members or dentists who were looking for associates at that time. And I was fortunate to fill my schedule to be in their practice and learn from each different type of dental practice, whether it was high end or more of, let's see patients and accept all types of insurances, or even a corporate office. I ended up at a corporate office with PDS. So I got a taste of everything from corporate to very high end. And when you are out there, you're the doctor, you're providing care for patients, that's like a huge responsibility. You go in and you're new and you're just like, holy crap, I need to know what the heck I'm doing. I need to know if I'm planning things right. I need to know like what's the best way to go about this procedure. And with a high quality practice, again, that was such a blessing to me because I had someone who would take the time to guide and teach me with every case. And that's not something that a lot of people get, But the reality is that we do need help, kind of someone holding our hand essentially. And I had my friends who would be in other practices and they're like, dude, I'm so stressed out. Like, I wish someone can help me. Like literally the doctor leaves and it's all on me, so then we're left. But then again, you figure it out. So whatever situation you're in, you end up figuring it out somehow, whether it's self-learning and really trying to figure out like, okay, what resources can I use other than a human being or a mentor to learn procedures, whether it's colleagues, your friends, calling each other, interacting and giving feedback, or even from online or resources, So my mentor always told me, he's like, listen, you will not feel super confident until 5 years has passed, right? And I was like, I'm going to do it before then. I don't know what he's talking about. And I'll never forget the 5-year mark to me. I started feeling so much more confident about everything that I was doing. I felt like I knew this, I got it down. I knew, the steps, the procedures, interacting with patients, taking care of them, all that fun stuff. But it's funny because there's that 5-year mark, right? That you're finally like, oh, I got the basics here. I think I'm getting it. And then you get the 10-year mark and you're like, holy crap, I've learned so much from year 1 to year 10, right? So there's like a 5-year, I think, period that you just have a growth in dentistry because you're always learning. You're always learning how to evolve. And if I were to tell you, if you were to kind of peek at my brain, my dental brain from year 1 to now, it's night and day, night and day. So you have to give yourself time. I think people want to be the best, do the best right away. But the reality is that just like any sport, you have to put in your time. You have to practice, right? You have to be dedicated. And I don't know. It's very interesting. It's a very interesting journey, because otherwise I think you think, hey, dental school, I'm ready to start, you know, being in the real world and I'm going to kill it. And you're out there and you're just like, this is not what I thought it would be. I mean, I even have colleagues to this day, I'm 11 years out, and they're just like, I don't know about dentistry. Like they talk about that with me, you know. So that's the reality of our field, essentially.
I'm curious to know that 11 years out, at these colleagues of yours, what don't they like about it?
You know, there's a lot that is evolving in dentistry, and you know, there's the digital, there's obviously the healthcare route of, again, managing a business nowadays. I think that is the biggest thing, because you do have to become essentially a business owner mindset, you know. You can't ignore that part of dentistry. And that part, you know, everyone says like the bread and butter of dentistry, that's the easy part. The procedures, you know, taking care of patients, like that's the easier part than having to manage a practice. So, you know, there's burnout too. I think when you are not in the right environment, and I do have colleagues who are 11 years out who are just not where they want to be. Um, and so they end up having burnout. They kind of regret what they've done. So like I said, you do have to create your environment. You have to focus on what makes me happy, because what makes you happy will, it's a domino effect, right? The patients will feel it. The staff members will feel it. Everyone around you feels your energy in a sense. And so you have to really harness on what makes you happy, finding your niche. Like if you are the type that loves to do everything, then do everything. If you're the type that loves to just focus on root canals, focus on root canals. Like if you love fillings, do fillings. Like, but again, I know the hardest part now, like I've mentioned, is also trying to manage a business. So then that's the difficulty. That's kind of someone like playing tug of war with you. You're like, okay, well, if I just want to focus on this, well, how do I make it so you can also be successful in that business aspect? So that's the struggle that a lot of people are feeling in a sense.
A question just came to mind, and it was a lot of dentists now, especially young dentists, think that success in dentistry is being able to do these smile transformations and taking on these big cases like a FMR case. And they think, because they see all these before and afters on Instagram, and they're like, I need to do this, and I need to, you know, deliver something like this in order to be a good dentist. Otherwise, like, what am I doing? You know? You mentioned earlier that during the 5 year conversation that we were having, that things take time. So I want to know for you, when you were in this 5 year transition or evolution, at what point in the 5 years were you taking on these types of cases?
I'll be honest with you, it hasn't been until about 3 years ago that I finally have gotten to a point where I'm like, this is how I do it. This is how I do it well. I've practiced for 11 years, but what I was laser focused on is my technique, right? Is how do I deliver high quality dentistry like I've talked about. And you start with one tooth. You start with two teeth. You start with three. You start with four. Then you can talk about, okay, let's do a whole transformation. But you're right. I mean, that is something that you look at on Instagram and it's like, oh, this, look at how many smiles this person has, you know, transformed. And that's supposedly success, you know. Why is it success? It's success because obviously it gives you a good amount of income. It's a big procedure. But the reality is that if you are just trying to do that and trying to make that the definition of a successful practice and a successful you, then you're in it for the wrong reasons. Because you could really, I think, mess up or end up kind of going the wrong rabbit hole of creating smiles that are not necessarily done properly. They're not easy to do. There's a lot of planning that goes into it, So, and you have to understand any one of us as dentists, I think we're trained to just look at a patient, they have a broken tooth, they have a missing tooth, I don't know, they have a cavity. Okay, this is how you fix it. But what is the underlying cause of that cavity, that broken tooth? How did it happen? We have to look at the underlying cause. That's what a lot of people are missing now. Any one of us can sit there and fix a tooth easily, but we have to look at the functionality of it as well. We can make people look pretty all day long, but is that going to be something that's going to last as long as we can, a lifetime, So that's a very good question, actually.
I appreciate you sharing that.
Huge, huge, huge. So much to learn too. You can't learn it all.
Going on, and I feel like one of the reasons why a lot of young dentists are overwhelmed is because they think that they have to deliver, these big cases, and they might not know how, they don't know where to start. They didn't come out learning that in dental school. We didn't. So yeah. Well, thank you for being on the Teeth Matter podcast. If anyone wanted to connect with you to maybe ask questions about how to navigate their career or maybe learn more about biomimetics, how can they reach you?
Oh, they can reach me via Instagram, obviously. DM me. Sometimes I don't go through all my DMs, so bear with me. I will get to them at some point. But also feel free to email me. I have on my website, drjenniferhaddad.com. You guys can connect with me there. You guys can email me. But I'm available and I'm here for anyone who needs help. I've been through it. I'm still going through it. So I'm not perfect. And it's been fun. I mean, it's been fun talking to you, and we are all here for each other. So never feel alone in your thoughts and how you feel and what you're going through. I think it's important to always lean on each other, support each other, and continue to focus on what you can do to be better as a clinician, as a person, just in your community. So I appreciate your time too. It's been really great talking to you. I admire what you're doing. I know that what we do is not necessarily easy. There's a lot of fun parts to it, but then there's a lot of stress to it. So that's just the reality of it. And us dealing with patients that we love so much, but then we have to care so much for them. I think you've heard this. Every time a dentist goes to inject a patient with anesthetic, their blood pressure goes up. Every time you're doing it. That goes to tell you how much stress we get put under just doing the simplest things. The day-to-day is administering anesthesia. So
yeah, no, I heard that from Dr. Kyle Stanley, actually.
Yeah, I love him too.
Yeah, but I was like, it makes sense. Thank you for being part of the community, and I appreciate your time. If you enjoyed this episode, be sure to follow our podcast, write a review, leave a comment. Anything you share with us goes a long way. And if you think a friend will appreciate this podcast, then make sure you share it with them too. Until next time, cheers.